As Maine blankets itself in pink to mark Breast Cancer Awareness Month, it may also be a time to determine if you are at genetic risk for breast cancer. According to the American Cancer Society, up to 10% of breast cancer cases are linked to an inherited faulty gene.
Today, New England cancer specialists opened a new high-risk cancer genetics clinic to help catch hereditary cancers early and give patients more access to preventative treatment and hope for survival. News Center Maine's Vivian Lee has the story from Scarborough.
To say that cancer runs in Robin Bourget's family is an understatement. The disease has impacted this mother of two older sisters, and her parents. Experts say only 5 to 10% of cancers are hereditary, developing from a genetic mutation in a person's cells at birth. After Robin's mom and sisters discovered they were carriers of the same mutation, Robin also underwent genetic testing at New England cancer specialists at the age of 35.
Once I found out about the mutation, I took preventative treatment options to reduce my risk.
That included surgery, annual mammograms, and breast MRIs to lower her risk for breast, skin, and ovarian cancers. Preemptive tools that would later catch stage 3 breast cancer. Sadly, she lost her mom to the same disease 10 years ago.
I had 2 large tumors and significant impact to my lymph nodes. I would not have celebrated my 47th birthday.
Robin spoke at the grand opening of the NECS's high-risk cancer genetics clinic. Genetic counseling, testing, assessments, and expanded patient management services are now available at all of NECS's locations in Maine and New Hampshire.
To create a comprehensive and holistic approach to the fight against cancer.
Picking up the white blood cells.
Oncology genetic counselors like Kelsey Fusco work with about 700 patients with a family history of cancer. If a patient wants to proceed with genetic counseling of 84 genes related to cancer risk, they can submit a blood or saliva sample that can be mailed to a patient's home. Patients can also meet with Dr. Elizabeth Dennis, who assesses factors in a patient's lifestyle, including diet and exercise. She then works with people who are carriers on how to prevent cancer and catch it early.
That may involve more aggressive breast imaging, or in some instances something called risk reduction surgery, which is having an elective mastectomy so as to decrease risk.
Now, genetic counselors say most insurance plans cover this type of genetic testing if a patient meets certain criteria. If a patient does have to pay out of pocket, the cost is about $250 or less.
Today, we're survivors because we knew.
Robin and her family are now part of a public awareness campaign about how genetic testing can save lives. After a double mastectomy and dozens of rounds of chemo and radiation, this mom is grateful she got the chance to fight cancer and survive. Vivian Lee, News Center, Maine.
We will have much more information on genetic testing for high-risk cancers in the News Center Maine app.